Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Qasim Rafiq, the head of media for the Federation of Student Islamic Societies, and I'm joined now with Faisal Hanjra, who is the former president of the Federation of Student Islamic Societies and is currently in Pakistan working to help the victims of the flood disaster. Now, Dr. Hanjra, the first question I wanted to ask was, can you describe what the situation is like at the moment in Pakistan?
Wa alaikum assalam wa rahmatullah. So, in the affected areas where we're currently stationed, which is in Nashera, and remember the floods has affected, vast quantities of the country, an area almost the size of England, some reports have stated. So, we're just in a very, very tiny part of it, which is Nashera, which is about 2.5 hours drive away from Islamabad. It's quite a easily accessible destination for a lot of the NGOs, which is why many of them have come here. This is so close to the capital. Other parts of Pakistan we hear are much more of a serious situation, haven't had as much help from some of the larger charities, just because of difficulties in terms of access, etc. The situation in Nashera, mashallah, is slightly improved from what it was last week. Coming into the city, coming into the towns around it, we see very, very obvious tents along the side of the road. We see tent villages almost having been set up by international NGOs who are in the position helping out. You've got the United Nations represented here. So the situation certainly looks like there's been a significant disaster of sorts. We see fairly, significant destruction in some parts, houses which have clearly collapsed, and people generally displaced sitting out on the street. At medical clinics, small medical clinics have been set up. They're seeing something like 500 to 600 patients a day, with one or two doctors. So again, it's a significant strain in terms of the very limited resources that are out here. So things are difficult, but certainly not as bad as they were previously. I mean, in previous, last week or the week before, they were talking about actual roads and highways and motorways actually being blocked because of the sheer number of people who had been evacuated and who had nowhere else to go. So that's the situation. More aid started to reach the areas affected, which obviously helped the people. But there's still so much to do and so much going on. It's really quite awesome in terms of its scale.
Now, you're working in Pakistan in your capacity as a doctor. I mean, what sorts of diseases are you finding common amongst the victims?
The sorts of diseases we're seeing here are pretty much the sort of diseases that you'd be expected to see in any sort of refugee, disaster situation. And just to be clear, I've got no previous relief experience. This is my first venture, if you like. The sorts of things we're seeing are things like scabies, which is a skin condition as a result of, very close contact with lots of different people and quite dirty living conditions. We're seeing lots of chest infections, as you'd expect. We're seeing lots and lots and lots of cases of diarrhea, particularly in young children. And diarrhea, as a result of either infection or viruses or eating contaminated foods, diarrhea is very easy to treat in terms of maintaining the right fluid balance. But it's very easy to treat if you have the right medication in place. But if you don't, then it can be potentially quite fatal. So we see a lot of diarrhea. We've begun to see increasingly now an increasing number of cases of malaria. The flood waters have begun to recede, but where the flood waters were, if you like, are now large standing pools of water. And these standing pools of water are breeding grounds for mosquitoes and are sources of infection in terms of waterborne diseases, etc. So more and more cases of malaria are coming to the fore. And those are the main concerns which we're seeing coming forward now. Over the next couple of months, they're worried about, lots of pregnant women in terms of how they're going to give birth and mechanisms and the infrastructure set up for that. Apparently there isn't much in place. So those sorts of diseases are the sorts of things which we're currently seeing.
In terms of the actual the victims themselves, what has the reception been like for the fact that a British doctor has come over and is looking to start helping them and looking to start treating them? What has the reception been like for yourself?
Broadly speaking, the reception by many of the local charities as well as the local people has been one of incredible gratitude. They're obviously very happy and very relieved to see international agencies and international organisations and people from different countries abroad actually coming in to help. There are a number of different countries actually represented here, from Sri Lanka to Malaysia to Qatar to the UK to the US to Canada, who have sent actually doctors over to help out for a short time in a limited capacity. And the reaction afforded by the people has been one of incredible gratitude. not to forget, I think it's really important to know that the local Pakistani doctors are doing an incredible job. Absolutely phenomenal in terms of the hours they're working, the kind of caseloads they're having to deal with, often in very, very poor conditions for very, very little pay. And it's them who are driving, if you like, the relief effort more so than the international team. It's very much the local charities, the local organisations with the local know-how and the local infrastructure that are delivering many of the projects. Just to add something to your previous question, which is about how people are in terms of their health and what kind of things they're seeing, something which has become more and more apparent are concerns around mental health, just the sheer shock, the sheer scale of the disaster, in terms of the impact it's had on people's livelihoods. There's immense, people who say for years and years and years, almost men who bought homes and families and all the rest of it. All of that physical infrastructure suddenly disappeared. Crops gone, cattle gone. It's an immense shock and it's an immense blow, which is in years I think to recover from.
May Allah help you and all the brothers and sisters out there, inshallah. Just the last couple of questions I wanted to ask. A lot of people have seen the videos that you've filmed for us, and a lot of them have been inspired by the work that you're doing. What is it that people in the UK can actually do to help?
I think a couple of things. And one, after all the cameras have gone, it's obviously to remember that there's still an ongoing disaster in Pakistan. It's just a disaster that take the country years to recover from. And there are desperately in need of money for medication, money in need for a whole variety of things. And there are a lot of local charities who you can give directly to. And I'm more than happy to put people in touch with them, charities you can trust in terms of actually being able to deliver the goods. With 100%, 100% of money goes to the goods and all the rest of it. So raising money, remembering the people, making lots of dua, and a lot of, as I was, might be a little bit naive thinking they can come out here and help turn things around, or help out here in a considerable way. Every single doctor who comes out here has a potential to make a significant impact, and every single doctor is a real need. As the month, it's what I think the month in December, I started to guess it's getting much more and more harder to man these medical camps with volunteer doctors from the local population, because these guys need to return back to work. They need to start putting bread on the table. The situation in Pakistan in other areas, in other ways, is quite severe. So there is certainly need for local doctors and international doctors to come out here and help if possible. But they should get involved with relief organisations like Doctors Worldwide, and other international relief organisations, just to help support they have the infrastructure and some of the training which is necessary to survive out here. It's a difficult situation, there are difficult circumstances, and the environment is difficult, the living environment is difficult, and if you haven't had some insight into that, and if you're not used to that, you're going to suffer. And that's as applicable to me as it is to anybody else.
Jazakallah khair, Faisal. I mean, you're doing a fantastic job out there, and our du'as and our support and our prayers are being directed towards you and all the brothers and sisters out there, inshallah. We just hope that you keep firm and you really try and do as much as you can out there, and hopefully through these videos that you're producing for us and these audio messages, you can really inspire a whole generation, inshallah, to kind of go forward and really start helping people in disaster zones and so on and so forth. So with that, inshallah, Faisal, I won't take up any more of your time, any more of your valuable time, and we'll conclude it there. Jazakallah khair, Faisal, and hopefully we'll speak again soon, inshallah.
Thanks for your support.
Assalamu alaikum. That was Dr. Faisal Hanjra, the former president of the Federation of Student Islamic Societies and a qualified doctor. He's currently in Pakistan, as you've just heard, and he's treating the victims out there. So inshallah, with your support, with your help, with your assistance, we can really make a difference. Mashallah, we have Faisal out there. If you can donate, please check out the FOSIS website, www.fosis.org.uk. All the details on the front page as to how to donate. You can send a bank transfer. You can send checks and postal orders. So please do get involved. Please do donate. Please do make dua for the brothers and sisters out there. And as Faisal suggested, there is dire need for healthcare professionals to get out there and really use their academic and professional knowledge to assist the brothers and sisters in Pakistan. So inshallah, if you would like to get involved, again, please contact FOSIS, and upon Faisal's return, inshallah, hopefully he can provide further advice on how to get involved practically. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.